management on the occasion of World Stroke Day, presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram here. Stroke is a very good example of a disease that you need to be fully aware of. Why? Because it is a disease which is serious and even fatal, but it may begin with the mildest signs, which you may miss completely if you're unaware of what you're looking for. Secondly, this is one condition which can be having very great outcomes if it is treated immediately, and if sustained rehabilitation is done, there could be great outcomes and recovery too. So what happens next if you do get a stroke? How does life go on? To what extent is normal life possible? What are the various methods of rehabilitation? Rehabilitation is nothing but a number of therapies that are designed to help you to relearn skills that are lost after a stroke, depending on which part of the brain is affected. Rehabilitation can help with movement, speech, strength, daily living skills. It can help you regain independence and improve your quality of life. And studies have found that people who do undergo stroke rehabilitation do much better than those who do not. So today, to discuss all about life after stroke and how you can cope and recover to the best possible extent after stroke, I am delighted and honored to welcome Dr. Sudhir Kumar. Dr. Sudhir Kumar is currently working as consultant neurologist at Apollo Hospitals, Jubilee Hills, Hyderabad since 2004. In the past, he has worked as also lecturer and consultant neurologist at the Christian Medical College, Vellore. Dr. Sudhir Kumar has received his medical MBBS and MD medicine as well as his DM neurology training at CMC Vellore. He's one of the youngest to qualify as a neurologist with an experience of over 22 years in managing patients with various neurological diseases. His areas of expertise include brain stroke, neurocritical care, epilepsy, neuropathic pain, dementia, migraine, and many other neurological disorders. He has over 125 published papers in peer-reviewed national and international journals, along with multiple book chapters, monographs, paper presentations, clinical trials, has published the first EEG atlas in the country, a regular speaker at various national and international conferences, on the editorial board of several journals such as Neurology India, Indian Journal of Critical Care Medicine, and so on, and is passionate about teaching. Several students of medicine have benefited greatly from his expert guidance. Welcome, Dr. Sudhir Kumar, to this special session on World Stroke Day. So let us begin by first a few introductory remarks about what exactly a stroke is and what happens during a stroke.
Thank you, Dr. Srinidhi, and namaste to all the viewers. So to start off, stroke is one of the most devastating, disabling conditions. So the only two other conditions that are more common than stroke will be cancer and heart attacks. And in stroke, basically a part of brain gets affected due to sudden blockage of blood supply, and in a small minority due to rupture of blood vessel, what is called as brain hemorrhage. And so the part of brain stops functioning. So suddenly the patient has various neurological deficits. It could be problem with speaking, problem in moving the arm or leg, and things like that. So that is the basic mechanism and the definition of stroke.
So what are some of the main causes of stroke?
If we look at the causes, we can broadly classify into two types. In the first, it is called ischemic, where the blood supply gets blocked. And the second is hemorrhagic, where the blood vessel ruptures and the blood leaks out. And if you look at the risk factors in our country, high blood pressure, high blood sugar, high cholesterol, obesity, smoking, high alcohol consumption, sedentary lifestyle, lack of sleep at night, and of course, older age, and then family history of stroke. So these are some of the common risk factors in our country, just like many countries in the West also. So these still remain the most common risk factors for the stroke. In the recent times, we have seen COVID pandemic also. COVID is one of the conditions which caused clotting of blood in the brain. And that also is one of the new causes we have seen in the last 2 years.
I see. So, how does stroke exactly change what happens and what a person is able to do, and what would they not be able to do?
Yes, stroke is, it's a sudden disease. So the person is totally perfect, before that disease. And once the stroke strikes, the life is totally changed and for the bad, actually. If the treatment is not done properly, so it can be, the person can be happily employed in the work, taking care of the family members, enjoying his life. On one fine day at a particular time, there is sudden disruption of, brain and neuro functions. The person may lose the ability to speak or understand. The person may develop weakness of the arm or leg, or may have imbalance while walking, sometimes difficulty in swallowing. So these are all basic life functions. Without these, one cannot function. So the life almost comes to a standstill for a person who suffers from stroke. But if we have good treatments and rehab, which we'll discuss later, but if the stroke strikes a person, basically the person is totally devastated. His personal life, professional life, and social life, all these three aspects get affected after the stroke.
So, there are two aspects to stroke treatment. One is the immediate stroke treatment, and then it is the post stroke rehabilitation. So, first, let's talk a little bit about what is the latest in the immediate. What should one do if there are warning signs of stroke, and how important is timeliness?
Yes. So the brain neurons, as we know, they are highly sensitive to any lack of blood flow. So, just few minutes of stoppage of blood to the brain will damage the brain neurons. The second point we should remember is that once the brain neurons get damaged, the damage is irreversible, means it doesn't become normal. If the person is more than 8 years of age, in a child, in a very, very young child, there is something called neuronal plasticity, where even if the brain nerves get damaged, some degree of regeneration can happen. But in adults and older people, that doesn't happen. So with the each moment, each minute after stroke, any delay in treatment will damage more and more. There are some numbers like millions of nerves get damaged per minute delay in the treatment of stroke. And in all the studies, what has been shown is that the first 4.5 hours, that is the critical window we have after the symptoms develop for the person to get better. And when I say 4.5 hours, doesn't mean that we should wait for that 4.5 hours and treat. Earlier we treat, better are the outcomes. So if a patient gets treatment in the first 45 minutes, he will do better than the person who got treatment at the end of 3 hours. So every minute is precious. So we are preventing more and more neurons from getting damaged. So that is the first aspect. So which brings us on to the next point is that how can one recognize the symptoms of stroke? Because unless we recognize, we cannot seek medical help. So unlike, in heart attack, patient has severe chest pain. So, they know something is wrong and they rush to hospital. But most brain strokes, the headache is not a symptom. So severe headache can occur in a patient with brain hemorrhage, but more than 90% people may not have headache. So the common symptoms we can remember with an acronym called FAST, FAST. So the F refers to the face. So if you find that face is, crooked or deviated to one side, that means there is facial weakness. A stands for arms. So the person has to keep the arms outstretched. And you find that one side arm is drooping. The person is not able to hold. Same thing in the leg. It can be weakness of leg and the person is, wobbling or not able to walk steadily or falls down when trying to walk. So that could be a sign of stroke. And S stands for speech. Either the person is not able to speak or not able to understand the spoken words. So these are the three most common symptoms. And the T stands for time, because as I mentioned, time is important. So when someone has any of these symptoms, or if you notice any of these symptoms in your friend or family members, then it means that person could be suffering from stroke. And at that point, any delay should be avoided. Just rush to the nearest hospital where they have a CT scan facility and there is a neurologist available so that the treatment can be started early. And then your last part was what treatments are there. So the treatment is called as clot buster therapy. So basically in the brain stroke, there is a clot which forms in the artery, which prevents the blood from reaching that part of the brain. So we have injections we can give in the vein, which are called lytic drugs, thrombolytic drugs. They travel to the brain where the clot is there and dissolves the clot in the first 4.5 hours. And then if a person is beyond 4.5 hours, then we have something called an intervention where, just like angiograms, we can put the catheter and reach the area of the brain where clot is there, and the clot can be retrieved or removed. And that sometimes we have little extra time, can be done up to 6 to 8 hours also. And and so these are the different two major technologies. One is direct injection in the brain vein, and second is to retrieve the clot directly from the brain artery.
So after this initial treatment, what are the main aspects of rehab? How does one then recover, uh, and what functions are recovered through rehab?
Yes. So when we give this clot buster therapy, unfortunately, only about 10 to 20% people are able to receive it, because patients may not recognize the symptoms, or there could be a delay in reaching hospital. So 80% people don't get it. And even those who get thrombolized, some of them will have, this, they may not recover completely. So the patients are left with various kind of disabilities, which could be difficulty in speaking, what is called aphasia, difficulty in swallowing called dysphagia, and they have weakness of the arm and leg, imbalance of walking and using the hands. So these are some of the functions which can be improved with physiotherapy and rehabilitation. And the question comes, how early or how late should we start? So it should begin in the ICU. When the patient is there in the ICU, that is the time we assess their swallowing functions and start working on the swallowing aspect. Similarly, the passive movements, where the suppose patient cannot move at all. So then with the help of physiotherapists, we can start mobilizing the hands and the legs right in the ICU. And the earlier we start the physiotherapy, better are the outcomes. And then in the first 3 or 4 days, the ICU and the ward treatments get over generally. So day 4 or day 5 is the time when, instead of discharging home, if the patients have disabilities still left, then we shift them to our rehab center, which is in the same locality in this hospital. And every hospital has a tie-up with the rehab center, or physiotherapists are there. And with their help, we can work on the, motor disability, the weakness, imbalance, and speech therapists also can work. Swallow therapists are there. So with their intervention, the outcomes are better and recovery is faster. If we leave it, to recover on its own, either the deficits may not recover or they will recover incompletely.
So apart from the disabilities that you already mentioned, what are the other disabilities that can occur after a stroke?
Yes, I think 3 or 4 things I would like to mention here. So one is something called as post-stroke spasticity, where what happens as the recovery is happening, the strength in the hands and legs may increase, but they become tight. So they're not able to, the flexibility is lost in the arms. So when the person walks, they'll be holding the arm like this and walk. Sometimes when you see people walking on the roads also, they're keeping the legs totally straight. They're not able to flex at the knee. So that is called a stiffness of muscles or spasticity. And that is also disabling because the entire range of motion is not possible. So there also, with the help of physiotherapy exercises, some people may require specific injections called Botox injections and other treatments we can work on, reduce the spasticity. The second complication which we see in some people is called as post-stroke pain, especially if the stroke happens in a part of brain called as thalamus. Then the opposite side in the hands and legs, they have severe pain. It's called a central pain because the origin is in the brain. And so they may not have weakness, but the pain cripples the life. So for them also, we have good anti-pain medications which work on the central nervous system and relieves the pain. So that is the second thing. The third thing is called as post-stroke depression. Now, depression can be because of 2 reasons. One is if somebody is totally healthy and perfectly doing fine, there is sudden, disability coming in the life. It can make anyone depressed. So that is the direct cause. Second thing is certain parts of brain, like say frontal lobe. If that gets damaged, then the people can also get depressed. So that is because of specific damage of the specific parts of brain. And so that is the post-stroke depression. So it is not that, just by giving a pep talk, sometimes they may not improve. So they need sometimes the intervention by psychologists, counseling, and Also, antidepressants sometimes are required. And people who are depressed and their depression is treated, then the stroke outcomes also get better. And the
Right.
last post-stroke complication can be what is called post-stroke epilepsy or the post-stroke fits. So when the brain neurons are damaged, after healing, it forms a scar, just like any other part of body. If they heal, there is a scar. So scar left in the brain can give rise to fits. So if somebody has convulsions or when they become unconscious for a few minutes after stroke recovery, they require anti-epileptic drugs. With those medicines, these fits can be controlled.
So you were talking about the team that provides rehabilitation. So apart from the physiotherapists and the speech therapists, who are the professionals who are involved in stroke
Yes.
rehabilitation?
So I think today is the day when we should not forget the entire team. So stroke recovery or stroke treatment is a teamwork. It is not only the neurologist or the physicians and the nurses, but there is a big team which is involved in the rehabilitation of stroke patients. So in that we have physiotherapists which work on the strength, improving the strength of the arms and the legs. Then we have the speech therapist. So many people have slurred speech, they cannot speak, they cannot comprehend. So we have speech and the aphasia therapists, they work on the language and the speech. Then we have swallow therapists. So people who cannot swallow food, because swallowing is very important. One is for proper nutrition, one needs to swallow food and take, because otherwise we have to use a small pipe called as Ray's tube or the nasogastric feeds. In that only liquids can be given. And as we can understand, if someone gets only liquid diet, then the nutrition may not be adequate. So we have to work on the swallowing mechanism and make it better as early as possible so that the nutrition and diet can be improved. So they are the third people who are closely involved. Fourthly, we have occupational therapy. So all these things, when we are working on the speech and the motor functions and the power, the idea is that the person should, all these things should translate into some kind of useful outcome for the patient. If the person was involved in a job, he should go back to the job as early as possible, because otherwise it's a loss of income for the family and the entire family gets affected. So occupational therapy, they try to maximize the use of the limb, the functions of the limb, so that they can start walking earlier, or they can, whatever job they are doing, they can start doing that job. So that is the occupational therapist. And then we have also pain specialists, because I told there are some patients who have post-stroke pain, and if the medications do not work, then there are other treatments which the pain specialists can work on. So these are some of the important team members in rehab. And not to forget psychologists, I already mentioned. So psychologists, many times they need to give counseling to our stroke patients, and they do better with that.
So, where can one actually undergo rehabilitation? I mean, I know that Apollo Hospitals has a rehabilitation program, but generally, like, is it provided in all hospitals, or is it like a separate center that they have to go to?
Okay, see, there are 2 or 3 different methods by which one can take physiotherapy and rehabilitation. So most hospitals, they have in the hospital physiotherapists and occupational therapists, and like Apollo Hospital also has. So while the patient is under our unit in ICU or wards, they start they come every day, morning, evening, and spend 1 hour time with the patients. That is the initial rehab part. And once the patients are ready to get discharged, which happens after 3 to 5 days after the stroke, and then they have 2 options. Either they can come on daily basis to outpatient physiotherapy units. If the deficits are very mild, like suppose mild weakness of the arm, mild weakness of the leg, then they can come spend 1 or 2 hours daily. And if their home is nearby and someone is there to bring them to hospital, that is one good option. Some patients have severe disability, like they're on wheelchair or they're on stretcher, so mobility is not very good. Such patients do better with inpatient rehabilitation or admission. Luckily, in our Hyderabad unit, we have Apocos rehabilitation unit, and most centers have they have a tie-up with a good rehab inpatient facility. Now awareness has gone up, patients are inquiring, and luckily most of the cities have rehabilitation units where they have inpatient facilities. So there, the entire day, 6 to 8 hours, rehab specialists, physiotherapists, occupational therapists, and various team can work on them. Other advantage is that extra equipment, because if someone comes to daily outpatient center, then a lot of machines cannot be used. So now there's many advanced machines, equipments are there. If they're admitted, then they can be used also for at least for some patients. So that is, and the third option is patient stays at home, and then we have Apollo home care, or some similar programs where they have physiotherapists visiting homes of the patients and providing the same physiotherapy services.
Right. So what are you were talking about the machines. So apart from the team, what are the various technologies that are used in rehabilitation?
Yes, so I think one is the what is called tilt table is the very basic. So because if the patient lies down for a long time, and then suddenly if they have to sit and stand, they feel dizzy, what is called as postural drop in blood pressure. So they have postural giddiness. So they are put on the tilt table, and then gradually they'll be made to just, even though they are not able to stand, with the help of tilt table, the bodies can be lifted upright. And that also helps in the bowel movements. And if somebody has constipation, that gets better. And then there is something called as electrotherapy. Then there are different kinds of stimulators which can be used for stimulating the muscles and the nerves. And electrotherapy is there. And then nowadays we are using a lot of robots also, which are FDA approved machines, which help in the improvement of functions of the motor functions of the upper limbs, hands, and as well as the legs. So these equipments are there in any good rehab center, and we also have them. And they can be used depending on the patient's needs and requirements.
So now coming to now after they undergo this rehabilitation, the next worry is that there should not be a recurrence of the stroke. So what are the factors that they must take care of in their lifestyle so that they can avoid having another stroke? Is there any preventive mechanism, any medication?
Yes, stroke recurrence is a real risk. So those who have already suffered a stroke, then the chance of stroke recurrence may be almost 10 to 20%, in some cases up to 30%. So it does not mean that because they have recovered, they can just forget about it and lead a normal life without any precautions. So that is called as secondary prevention. So preventing second or third stroke in a person who already suffered from stroke is called secondary prevention. So for that, there are two aspects. First is to use medications which directly prevent the stroke. In that, we have two groups of drugs. One group is called blood thinners, like aspirin, clopidogrel. So these are the medicines that keep the blood thin, so blood flows to the brain easily. So some patients require single blood thinner, some require two blood thinners. And your doctor, for the patient, I'm telling you, doctors will decide whether they need one or two. The second group of drugs is called statins. So statins, commonly, as you know, it is used for lowering cholesterol. But even those patients who have normal cholesterol, statins reduce the risk of recurrence of stroke. So all ischemic stroke patients where the blood supply got blocked in the brain, they need to be on lifelong one antiplatelet and one statin. Some patients require two antiplatelets. The second part is to control the risk factors. So as I mentioned, the common risk factors are high blood pressure, diabetes, and high cholesterol. So we need to make sure that these are kept normal. The blood pressure target to prevent stroke is 130/80. So anyone who has high blood pressure, hypertension, they should take medications to keep the BP below 130/80. For that, role of medications are there. In the diet, they should not take extra salt because salt increases the blood pressure. So normal salt in the diet is fine, but anything which contains high amount of salt like pickles or papads, those things should be minimized in the diet. And then the third illness is the diabetes mellitus. So there the patient should look at their HbA1c. HbA1c or glycoside hemoglobin gives the average sugar in the previous 90 days. So all diabetics should check their HbA1c and keep it below 7. So below 7, the risk of stroke recurrence is very less. If it is higher than 7, they should meet their endocrinologist and physicians and control the sugar further. And other uncommon risk factors, like something called as homocysteine. So in the blood, there's amino acid. If homocysteine is high, it can cause stroke. So there are simple vitamins that can lower it. And certain personal habits like smoking and alcohol. So both have risk factors for stroke. So those who have been smoking, they should quit smoking. And those who did not smoke earlier, they should not start smoking. And alcohol, same thing. Alcohol, heavy alcohol, definitely it causes high risk of strokes. Somebody who takes occasional small amounts of alcohol may be fine, but regular drinking or heavy episodic drinking should be avoided. Looking at the lifestyle, if somebody has been sedentary before the stroke, they should become active, spend about 30 to 40 minutes walking, brisk walking, or running, or cycling, swimming, whatever the person likes, yoga. So, some kind of exercises should be started about 30 to 40 minutes per day for 5 days, at least 5 days in a week. If they are overweight, they should work on their weight and try to reduce through diet and exercise. And regular sleep of 7 to 9 hours per night is also useful. And not to mention, forget the stress. So stress nowadays is very high. So if somebody has been under stress due to job or family, they should work on that and try to reduce the stress.
We also hear nowadays about surgical methods like the non-invasive brain stimulation, wearable devices. So how useful are they in stroke recovery?
Yes, there is a role of something called as transcranial magnetic stimulation, TMS. So there have been multiple research papers on that. And all of them have shown that the recovery is good in patients who are given this transcranial magnetic stimulation. But somehow the improvement was not statistically significant. So FDA has not approved it, but I know that many of my colleagues, they use it for selected group of patients. So definitely it can be useful on case by case basis. And your neurologist and rehab specialist, they will guide you on that.
Also let me ask you about, when it comes to stroke, as you yourself said, it's not just the patient, but even the family, the caregivers. So any words of advice to the caregivers of a stroke patient?
Yes, it can be an enormous burden on the caregivers because if person is disabled, then usually the person has been the breadwinner or the earning member of the family. They are usually adults and who have been totally independent earlier. So if such a patient needs support, even so much support that they need to be fed, they need to be given bath, cleaned, toileting needs, all those needs are there. And it is not just for a day or for a few hours. It is day after day for several weeks to months. Many patients take several months to recover. So this can be a cause of enormous stress on the caregiver, called caregiver burden. I know many patients, many caregivers, they go into depression and stress themselves. If they have blood pressure, the BP also can rise. So we need to, be very careful and, mindful that the burden is not on one person. So they should be shared. If one person cannot give care 24 hours, so in the initial few weeks or months, it may be good to hire a nurse. Nowadays, we have nurses through Apollo Home Care or other similar agencies who can come and help for a few hours. And also, if we should assess their mood. If they are going into depression themselves, then that also needs to be addressed. So it's a definite need. We should understand that they're also having a lot of stress physically and mentally.
So thank you, Dr. Sudhir. So I hope, dear viewers, that you found this session useful. So the key message is that it's not all doom and end of the road with stroke. If you seek immediate medical attention as soon as you notice the signs and symptoms of a stroke, and even if they seem to disappear, better to not to be complicit, but to think fast, act fast, and follow the fast. Before we conclude, Doctor, I'm just receiving some questions which have come in from some of our viewers. So they've just come in. So can I ask you these questions?
Sure, please go ahead.
So we have a question from Lata from the LinkedIn platform saying that, does a stroke shorten your lifespan?
I think that's a good question. I don't want to scare people, but if stroke is not treated, then it can cause death in about 30% of people. So that is those who are not treated. So that is out of question. So stroke needs treatment. If the stroke is treated, and we have looked at our data in the last 15 or 20 years. So those who reach hospital, the death rate becomes less than 10% or sometimes 5% also. So the key is to seek treatment as early as possible. We can reduce the death rate from 30 to 40% to less than 10%.
Thank you. Karthik from the YouTube platform asks, do strokes cause permanent brain damage?
The answer is on similar lines. If stroke is not treated and the lack of blood flow is allowed to remain for longer time, more than 4.5 hours, then the neurons get damaged forever. They don't recover back. But if we do the clot buster therapy, what is called thrombolytic therapy, early at the earliest possible time, then we can prevent the permanent damage, and most neurons can recover in that much time. And we have 4.5 hours to 6 hours time in the beginning after stroke symptom onset.
Satish from Facebook asks, in terms of diet, what food items should be avoided post-stroke?
Basically the harmful foods are the S. One is sugar. So anything which contains sugar, even if somebody is not a diabetic, try to avoid or minimize the amount of sugar, because that gives extra calories, converts to fat if it's not burnt. Second is the salt, especially in those who are hypertensive. So too much of salt should be avoided. And generally any high carb. Most of us are consuming more than what our body requires. So cut down on unnecessary consumption. In our country, we are too fond of ordering food online and then also going out and eating. And generally they are rich in oil and carbohydrates. So eating out should be minimized. Home food is the best. And consume more of fresh fruits, vegetables. So fresh fruits are better than fruit juices, because juices are high in calories, high amount of sugar, and also there is no fiber. In whole fruits, there is more fiber and less of sugar, and also brings early satiety. So you can't overeat. If you're having just juice on empty stomach, you can have 2-3 glasses also, which gives you a lot of calories. So these are some of the basic stuff.
Final question from Priyanka, LinkedIn. I need a suggestion about my mom's problem. She's diabetic since the last 5 years, and sometimes she gets dizziness and silent for 2-3 minutes. So please suggest what to do. Is this a sign of stroke?
It's a very good question. So if somebody is silent for 2 to 3 minutes, it can only be two things. One is it can be a small minor seizure where the person's brain is not working and the person is silent. It could be what is called complex partial seizure, like a type of epilepsy. And second thing is what is called TIA, transient ischemic attack, where the blood flow to the brain is reduced for some time. So both these are treatable. If you consult a neurologist, then appropriate medications can be started and any further damage can be prevented.
Right. So thank you, doctor. Sorry to have interrupted you again with these questions. But thank you, viewers, for asking in these questions. And do remember that you can continue to reach out to us in all our social media channels, in our app, in our website, and also in our hospitals and clinics throughout the country. So we are always here. So at the earliest sign, earliest doubt, please seek immediate help. Also on this day, which is dedicated to stroke, let us also remember that it's also not too late to start modifying lifestyles today, get the stroke risk reduced. So let's take a pledge today that our body is very precious, irreplaceable, and we have to take full responsibility and take care of it well. So till we meet again, stay safe, stay healthy. Thank you, Dr. Sudhir. See you all soon, and namaste.
Sure. Thank you, all the viewers, and namaste.